Good morning, Joanne. How are you today?
I'm good.
Good. My name's Sheena. I'm a student nurse, and I'm here to assist you with a bed bath and oral cares. Is that all right with you?
Yep.
All right. Can I get your name and date of birth?
Joanne Jones, 12/3/1956.
Perfect. And then, Joanne, are you in any pain this morning on a scale from 0, meaning no pain at all, and 10 to the worst pain that you've ever been? So 0 to 10. Can you give me a pain rating?
0. No pain.
Perfect. Okay, Miss Joanne, I'm going to put this bath in progress sign up on the door for privacy, and then we will get started.
All right.
I am going to perform hand hygiene. I'm going to put gloves on. Okay. Where are your oral care supplies? Check. Oh, forgot to put them away the other day. Or last night. All right, Miss Joanne. We're gonna start. I would put water in this cup, in the gray cup, mouthwash in the pink cup, diluted. We are going to do toothpaste on the toothbrush. This is for spitting out the extra toothpaste. If we had an unconscious resident, I would be checking for a gag reflex, putting mouthwash on the toothette, have suction ready. If there's a gag reflex, then go as normal. If there is no gag reflex, I would be laying the patient on their side and just doing the outside gums, squeezing out the toothette as much as possible. So, Joanne, I'm going to let you get started on that. I'm going to go and get your water ready. Okay, I would do 105, one with soap, 105 degrees, excuse me, one with soap, one with no soap. I would check with my wrist or my elbow to verify that it's not too hot. Okay, now we're going to get started. Miss Joanne, are you all set?
Yes.
All right. I would rinse all of this stuff out. I'm going to set it aside for now. Okay, I have a bath cap, which we would heat for 30 seconds in the microwave. It is a no rinse bath cap for shampooing. I have deodorant, lotion for the back rub, and soap. So we're going to set this here. We have our wash rags, which do 2 and 2. Okay, Miss Joanne, I'm going to put this stuff on the side so we don't hit anything. And I checked the chart. She is able to lay flat. Take this. We're going to get rid of this, Miss Joanne. In the laundry. We're going to do bed at the waist height. Perfect. So dirty laundry. Miss Joanne, we are going to put a bath blanket on you. So we make sure that you stay nice and warm. Right. My ducks in a row here. Okay. So, folded. Perfect. These sheets are going to go into the laundry, so we're just going to take them off now, make sure that they don't touch the clothing. All right, Miss Joanne, we're going to take this pillow out from behind your head, support the head. We are going to take the pillowcase off and put this in the laundry as well. If the pillow was soiled, I would disinfect afterwards. And now, Miss Joanne, we're going to take your gown off. So, if you can assist me with lifting your arm. Perfect. able to, I'd ask her to hold the sheet up so then there was no issue with it falling down on her. So we're gonna get rid of that. Okay, we are going to take, this is where we put our bath cap on. Again, heated. I have just water, no soap on this. I would make a mitt, and then I would start with the inner canthus of the eye. Joanne, I'm going to put this towel behind your head. Perfect. Okay. Start from the inner canthus of the eye, working out. So gently wipe away anything that's there. Flip with each swipe. And I would move to the face, behind the ears, the neck. And I would pat dry. Perfect. Okay, Miss Joanne, I'm going to bare your arm. We are going to go right. So soapy water. And I'm going to wash the hands. Getting underneath the fingers really well, in between the fingers. Bed bath is a perfect time to be able to do a skin assessment. This is just rinse water and a towel for rinsing. I would take both of these because they are dirty. Hands are one of the dirtiest things. I would put them in there. Dirty laundry. Okay. I would take soapy water and a rag. I would start from distal to proximal, long strokes, going up, making sure that I got everything as well as the armpit. We're gonna rinse, long strokes, turning the wash right every time, get the armpit good. Check for pat dry, check for any skin breakdowns in the armpits. Miss Joanne, do you want deodorant on this morning?
Yes, please.
All right. Help me lift up. I would put deodorant on. All right. After that, I would. Okay. Miss Joanne, you're going to get a little bit chilly here. We're going to wash the torso. Okay. I'm going to start here. Make sure that we get the neck. Sometimes there are folds that you have to get into. Soapy water. Miss Joanne, I'm going to pull this back here. We're going to wash the torso, strokes, make sure we get under the breasts really well. Look for any breakdown, skin folds again. I'm going to take clean rinse water, and then I'm going to pat dry. All right. And then I'm going to do the same for the stomach. I would do strokes with soap water, strokes with rinse water, and pat dry. All right, Miss Joanne. We're going to do the feet. I'm going to bare one leg. Okay, I would wash the toes really well, the feet, make sure that there was no lesions or skin tears, bed sores, anything like that. Then I would rinse really well and pat dry really well. I want to make sure that the feet are dry. I would go the leg distal to proximal, go all the way up, and long strokes with soap water. In rinse water, I would do the same thing, changing the washcloth every time, and then I would pat dry. Okay, we are going to wash Joanne's back now. Miss Joanne, that is dirty now. Can you help us sit up so we can wash your back?
Yep.
Do you want any lotion on your back today?
No, thank you.
Okay, so you can help us, Joanne. Perfect. Again, long strokes with soapy water. Are you able to hold it for a second? All right. We've got water to rinse. Perfect. Pat dry. Joanne does not want lotion. We would do a lotion and a back rub if that is what she desired. All right, Miss Joanne, we are gonna lay back down. Perfect. Okay, now we would start the peri area. So I would change my gloves, change my water, new soapy water, new everything. Okay, Miss Joanne, I'm gonna have you roll towards McKenna. And no, I'm not. We're gonna wash your front real quick. Okay, so with perineal care, I would try to expose as little as possible, and you would start with the outer and change your direction of your rag. Outer, change down the middle. Do that until they're not soiled. Take a rinse, outer, outer, inner, and then pat dry. All right. Now, if they were soiled in the, with a bowel movement or anything like that, I would change gloves as needed. Miss Joanne, I'm going to have you go towards McKenna here. Assist. Keep you covered up. Okay. We are going to get soapy water. I could replace a brief under here if needed. We are going to do the outer gluteal, outer, and the inner. You're going to change your rag at every time until they're not dirty anymore. Outer, outer, inner, and you're going to pat dry. Okay, this is where we are going to change bedding. I would take my gloves and change them right now because we just did peri-care and I do not want to get all of that on her new bedding. So you are going to tuck all of this bedding under. Put the barrier down. We're going to fan fold. No wrinkles. Tuck under the sheets. We're going to do a fitted. See. Mask. This is a little fitted. Again, tuck under. If the bed was soiled, I would encourage Joanne to get up into a chair while the bed was disinfected. If she was not wanting to get up out of the chair, then we would put a barrier underneath and change the bed while disinfecting to ensure that nothing gets on her sheets. Fan fold this as well. We're going to go from shoulders to hips. Tuck under that as well. No wrinkles. Miss Joanne, you are going to roll back towards me. Watch the bump. All right. Perfect. Support at the knee, support at the shoulder. Roll back, Joanne. Get you untangled here. cap off prior to changing the sheets. We are going to put a gown on her. It's Joanne. Okay, help me lift your arm here, Joanne. Perfect. Perfect. Make sure that she is all set under here. Pillow, real quick, Joanne, so you're not extending your neck. You're going to do tags on the inside, opening of the pillow facing the window for germ purposes. All right, Miss Joanne, I'm going to support your neck. Up a little bit, there you go. Okay. We're going to put a sheet on. It's Joanne. I folded these. And then we would slide the bath towel down. We would ask Joanne to keep the sheet up on her. She is able to. Dirty laundry. Now we're going to do a blanket. Alright, we're gonna fan fold the top. Underarms, lift up with me, Joanne. Perfect. We're gonna tuck under the bed here, do a mitered corner, safety reasons. We're also going to pull up on the end of the bed so it doesn't put pressure on our feet. Joanne, I'm gonna sit you up here. Tell me when you're comfortable, please.
That's good.
Right, I'm gonna lower your bed. Miss Joanne, here is your TV remote, keeping the cords out of the way. Call bell is within reach. Are you thirsty, Joanne?
No, thank you.
All right, I'm gonna get rid of all of your towels, rags, wipe everything out, and then I would document any findings that I had on skin breakdown, anything like that. Clean up the room, and if you need anything, Miss Joanne, please give me a call.
Thank you.
Thank you. I'm gonna perform hand hygiene on my way out.